Hi everyone, welcome to mindbraintalks. Today, let's dive into the fascinating topic that is very important to me, which is the topic related to emotion-focused therapy. This is very important to me because I use it in my daily practice. So, if you want to understand the basis of this therapeutic approach, this video is for you. So, what is EFT? Emotion-focused therapy is a form of psychotherapy related to the humanistic or experiential approaches that are aimed to transform maladaptive emotional reactions through emotion-focused tasks. The idea is that affective experiences influence cognition, emotions, and behavior and are linked to core emotional needs. EFT was developed by Dr. Leslie Greenberg and colleagues, and EFT may also be known as Process-Experiential therapy because it explores emotion processes related to emotion processing and emotion processing difficulties. So, you might be wondering, why emotions? Why emotional experience? Well, emotions are at the core of our human experience. They drive our actions, influence our thoughts, and shape our relationships. Yet, sometimes our emotional responses can be maladaptive. These are the emotions that lead to negative patterns of interaction. Think about those moments when you react with unnecessary anger or paralyzing sadness. EFT is all about identifying these maladaptive emotional responses and transforming them into healthier, more adaptive ones. It's like tuning an instrument. You're fine-tuning your emotional responses to create a more harmonious life. According to EFT, there are 6 principles of emotion processing. First, awareness and naming of emotion. Second, emotion expression. Third, regulation of emotion. 4, regulation of experience. 5, transformation of emotion by emotion. And 6, corrective experience of emotion. By using these principles, therapists may help patients to overcome emotional difficulties and transform maladaptive emotions with more adaptive emotions. Now, in the EFT, let's explore different types of emotional responses. These emotional responses are responsible for emotional suffering and maladaptive reactions. So let's take a look at them. There are primary adaptive emotions, which are your initial gut-level reactions based on a given stimulus that have a clear beneficial value in the present situation, such as fear from threat, anger at psychological violation, or sadness at loss. Then, there are primary maladaptive emotions, which is also related to basic emotional responses to a given stimulus. However, they stem out from maladaptive emotion schemes that represent past traumas, such as chronic feelings of insecurity or feelings of shame, also fear from positive effect from others, or sadness in happy seasons. These dysfunctional emotional reactions represent past traumas and they are not related to the actual context of the person. Then, there are secondary emotions. These secondary emotions are reactions to our primary emotions, like feeling ashamed because you're angry. And finally, there are instrumental emotions, which are used specifically to influence others. Think about crocodile tears. Understanding these types of emotional responses is crucial because it helps you to untangle the complex web of our emotional life. Now, let's look at clinical decision-making in EFT. EFT intervention is guided by clinical markers, where patients' emotion processing difficulties are acknowledged as emotion markers and used for task selection. Let's dive into the 6 core markers, although there are many more, okay? But here I will only cover these 6. First, the vulnerability marker calls for empathic affirmation, aiming at developing self-affirmation where individual feels understood, hopeful, and stronger. Second, the attentional focus difficulty marker, which calls for clearing a space, where the individual develops the ability to work productively with experience. Third, the unclear feeling marker calls for experiential focusing, where individuals develop a symbolization of felt sense and a readiness to apply this new symbolization of felt sense outside of therapy. Fourth, the problematic reaction marker calls for systematic unfolding, aiming to develop a new view of the self in the world functioning. 5. The self-interruption and/or critical split markers call for chair work, aiming to develop self-acceptance, integration, and self-expression. Finally, the unfinished business marker calls for empty chair work, aiming at let go of resentments, unmet needs regarding others, and understanding the past or holding others accountable. So, these are the most important markers in EFT. So, what do you think of EFT? Does it work for you? Are you interested in knowing more? Let me know it in the comment section below. Well, it's all for today. Welcome to Mind Brain Talks, and I hope to see you in the next video. Bye!